Yes.
Okay, well, now today we start with syndesmology. Our lectures today will be syndesmology, and 2 lectures more. We'll speak about the connections and type of connections of.
Excuse me, Professor. We are medical students, and it's our first session that we attending your lecture.
First session.
Yes, that's first session for medical students.
Look, students, no, it's not the first session. We start our anatomy lecture course in the last days of September. I think you from the last orders, yes?
Professor, in our schedule, last session it was for dentistry students, not for us.
It's your first lecture, yes?
Yes, for medical students, it is our first lecture.
First lecture. Okay.
No, it's not. It's our second lecture.
It is second lecture.
First lecture also.
Look, students, some of you have the first lecture, half of you some second lecture. What should I do? What I must do? I think in your timetable it will be the second one. Yes, but some of you
Yes, it is second lecture.
Starts a little bit later than another. Yes.
Yes,
Yes.
Professor.
But by my timetable, my schedule, scale is the second must be one. That's why we start with the syndesmology just now, because we have the plan of education, and some of you maybe have the orders to starting of education from the first days of the October. Yes, I think yes. Okay, but
yes.
You may find my first lecture in our team, I think. And if you haven't it, I will download it. But now we must speak about this syndesmology, the types of the connections of the bones. Okay, students, what we can say about the syndesmology? Syndesmology is the science about the connection of the bones. And first, we have 3 types of connections. Its first one is synarthrosis. It's the connection between 2 bones. Between these 2 bones.
Excuse me.
What?
I couldn't see your screen. Everybody can see. I don't know.
You don't
Yes,
see
we
my.
can see.
You see it?
Yes, we see.
Yes, we see.
Right now,
right.
I can see.
Yes,
Okay.
we see.
Very well. That's why. Let's continue. Synarthrosis is the connection between 2 bones, and between these 2 bones, connective tissue. Second kind of connections is diarthrosis. Between 2 surfaces of the bones, or maybe more the surface of between the surfaces of the bones, situates the cartilage, and present a gap covered by caps. Diarthrosis. Diarthrosis is the joint. Diarthrosis is the type of the joint. And the last one is the symphysis. Symphysis is the connection between the bones in which situates the gap inside but no capsule. And the difference between the diarthrosis and symphysis, that the gap in the symphysis present not by all the surface but or maybe all the longs of the articulation surface, so the surfaces of the bones. But in the diarthrosis you can see the gap between during all the longs of the 2 surfaces or articulation surfaces. And types of the bones. Look, first, between the ribs and vertebrae, you can see semi-mobile joints, but it's the joints. The vertebrae. Between the vertebrae, you can see the intervertebral discs between the bodies of the vertebrae. between the skull, for example, you can see mobile joints which names the sutures and fontanelles. In hip bone, you can see the ball and socket joint, and in elbow hinge joint. It's only like an examples. First, about synarthrosis. Synarthrosis, as I said, between the surfaces situates connective tissue, bone, solid connective tissue, and bone. This is synarthrosis, like a skin. And the synarthrosis may be first syndesmosis, one type of synarthrosis, synchondrosis, and synostosis. Let's discuss them one by one. Syndesmosis first is the sutures. Sutures between, it's look like a bone, a cartilaginous sutural ligament, and bone. Sutures can ossify, and the sutures you can find only in the bones of the skull. If we speak about sutures, we can find three kinds of sutures. First kind of sutures is sutures which situate between the big, huge bones of the roof of the skull. For example, between the frontal and parietal bone, and parietal and occipital bone. This kind of suture names sutura serrata, serrate sutures. These serrate sutures have sharp prominence part of the bones which go one into another, like a zip, for example, in your raincoat. And these sutures named serrate sutures. If we speak about the serrate sutures, three serrate sutures in the skull. First serrate suture between the frontal bone and parietal bone here. It's look like a crown, that's why it's named coronoid suture. Next kind of suture, which we can see on the skull, the serrate suture, it connects two parietal bones in the sagittal direction, in the at the most highest the roof of the skull. It's named sutura sagittalis, sagittal suture. And the last serrate suture connects parietal bone and the occipital squama. It's named lambdoid suture, sutura lambdoide. All these three sutures is serrate sutures, sutura serrata. First, coronoid suture, frontal squama or the frontal bone and parietal bone. Between two parietal bones situates sutura lambdoid, or sutura sagittalis, sagittal suture, and between parietal bone and squamous part of the occipital, sutura lambdoid suture. If you look to the neonate skull, between sutures you may find fontanelles. The fontanelles ossified in the first 2 years of human's life, and fontanelles will be useful for the growth of the skull, for enlargement of the skull. First fontanelle situates between frontal bone and two parietal bone. Its name's anterior fontanelle. Next fontanelle situates between the occipital bone and two parietal bone. Its name is posterior fontanelle. Also, at the level of the mastoid bone is situated mastoid fontanelle, and between the sphenoidal bone, frontal bone, and parietal bone, its name is sphenoidal fontanelles. 4 fontanelles, anterior, posterior, are unpaired, and mastoid and fontanelles are paired fontanelles, which are present in the left and right side of the skull. Next, syndesmology.
Excuse me, is this lecture for the student or student or both?
I don't hear you because the
Okay.
once again.
Yeah. Okay. Is this lecture for dentistry student or medical student or both of them?
This lecture I have in
Yes.
time two parts of foreign students, as in your timetable. We work with the first lecture with both parts, with general medicine and with dentistry. Look to your timetable next during in order of your timetable. If you have lecture today, you must present today. If you have lecture week, you must present until next week. But if you want to be present in both, in this week and at next week also. Okay?
Okay. Thank you.
Because I know that you have the both of parts of foreign students have free time today. It's not a problem if you present today, but your lecture will be next.
Excuse me.
Thank you,
Okay.
sir.
Excuse me.
What? The question.
Can you accept the students who request?
No, I haven't free time. I must continue my lecture. When we finished, I can do it. Okay?
Thank you.
Goodbye. We continue. Next time, the syndesmology is the ligaments. Ligaments connects to the cartilaginous interosseous ligaments. Look, in this picture, you can see here anterior longitudinal ligament and posterior longitudinal ligament is present here. They connect the bodies of the vertebrae. As the same, you see the ligament on the talocrural joint here. Next in this kind of the syndesmosis, its name is gamphosis. Gamphosis is the original kind of connection between the bones and tissue of the teeth. Bone, periodontium, and dental tissue. And periodontium is the thin layer of the connective tissue which connects the bone of the dental alveoli, alveolar dentalis, with the root of the dents. In the periodontium, you can see the periodontal complex, which consists of periodontal ligaments, nerves, and vessels. Only in the skull, only connection composes between the teeth and then root of the teeth and dental alveoli. Next kind of the syndesmosis in interosseous membrane. The interosseous membrane connects two bones one with other. The interosseous membrane situates at the level of the interosseous spaces. You can see the interosseous spaces in the bones of the forearm, and it situates, its name is membrana interosseous antebrachial, antebrachial interosseous membrane. This interosseous membrane connects the interosseous borders of the tibia, of the radius and ulna, and also, as you see in this picture, interosseous membrane connects interosseous border of the tibia and fibula. And you see interosseous membrane in the upper limbs and the lower limbs, free part of the upper limbs and a free part of. And as I said when we discussed the sutures, we have the fontanelles. These fontanelles is the connections between bones of the neurocranium in newborn skull. And these connections sit present only in the first 2 years of the human's life. Then they ossified. As I said, there are 4 fontanelles. Fonticulus anterior fontanelle between the frontal bone, squamous part of the frontal bone, and 2 parietal bones. Posterior fontanelle, fonticulus posterior between the parietal bones and the occipital squama. And 2 fontanelles which are paired, they lie in the lateral surface of the skull. First, fonticulus sphenoidalis, sphenoidal fontanelle, which connects sphenoidal bone with frontal and the parietal, and Panticulus mastoidofontinale, between the mastoid process of temporal bone, parietal, and occipital bones. This is fontanelles. Now we finished with syndesmosis and continues with synchondrosis. The synchondrosis is connection between bones and it's bound by cartilages, hyaline cartilage. Synchondrosis you may see when you learn the bones of the, for example, pelvic girdle. Chondrosis may ossified and may synastosis. Chondrosis situates in the young age of the human, and it situates between the bones. For example, in the hip bone, layer of the acetabulum, you can see the fusion between the bodies of the three bones of the hip. The ilium, ischium, and the pubis. Here situates the bodies of these three bones, and between the bodies of these three bones situates thin layer of the cartilage. Then they ossified and unit one solid bone. As the same you see in the sacrum. I think you remember that the sacrum consists of 5 sacral vertebrae, which units together and bound one solid bone. Between the vertebrae, 5 sacral vertebrae situates thin layer of the connective tissue, which ossified and also bound the sacral bone. That's why synchondrosis may ossified and bound synastosis. Synastosis connection between the bones, while the bony tissue bound the solid bone. And the last two, which must last two kind of connections, which we must discuss. First is symphysis. The symphysis. Symphysis, its connection between the bones via the hyaline cartilage, fibroelastic disc, which have the gap, then also hyaline cartilage bone. How it's look like? First, this and this is two surfaces of the symphysis, bony surfaces. These bony surfaces by hyaline cartilage. Here, as we see hyaline cartilage, this one, and hyaline cartilage in this. Between them, fibrocartilaginous disc. This is. In the disc, you can see the gap. And you listen my classification with attention. Now I show it here. Yes, there are so not a lot of differences between symphysis and symphysis, but they present. Look, the symphysis is partly mobile connection between the bones, and it's have the gap which situates all belongs between the articulation surface, between the symphysial surfaces. Here is present this gap, and maybe here and here is absent, but in the joints, in the diarthrosis, the gap present by all the longs of the articulation surfaces, which covers by the cartilages. And diarthrosis. Diarthrosis, it's the joints, the second name of them. Joints are mobile connection between the bones. Diarthrosis have two kinds of elements, obligatory elements and non-obligatory elements. The obligatory elements, first, articular surface, maybe two, maybe more. The articular surface covers by the articular capsule. Between articular surfaces presence articular cavity, and inside the articular cavity you can see the synovial or intra-articular fluid. Intra-articular fluid. Now I print it. Wait a moment. Intra-articular fluid. Sorry, in Russian. Intra. Articular fluid. Intra-articular fluid also is the necessary obligatory component of the joint. Articular surfaces, which are covers by capsule, articular cavity, intra-articular fluid, and intra-articular cartilage. Also, intra-articular. This is 5 obligatory elements. Let's name them once again. Articular surfaces, minimally 2, which covers by the articular capsule, which units these two
بچه
surfaces.
شما هم صدای استاد رو بد میشنوین یا مشکل از
Switch off
نت
your microphone.
منه؟
Please switch off your microphone. Keep silence. Okay. Articular capsule, which units to articular surface? Articular.
Teacher, excuse me, we can't hear you.
صداش تیکه تیکه میاد.
Excuse me. Your voice was cut off for us.
Your microphone is off, Professor. We cannot hear you.
Look, students. Okay, I see it. Some of you switch off my microphone, but I don't know what the reason of it. Okay, students, in which part you don't hear my explaining? You hear about synchondrosis? You hear my explaining about the synchondrosis?
No.
Yes,
Yes.
Yes.
Your voice,
Yes.
sometimes we can't hear you.
Okay, you hear about synastosis? Yes or no?
Yes.
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 You hear about symphysis? What I
Yes.
explained for you? Yes.
Yes.
You hear
Yes.
about diarthrosis?
Yeah, we
No.
were here.
We were on the
No.
interarticular cartilage.
Okay, once again, I repeat once again about diarthrosis. Diarthrosis consists of obligatory elements and non-obligatory elements. What it means obligatory elements? These 5 positions, 1, 2, 3, 4, 5, which situate left side of your laptop, it must be present in all kinds without the matter of their classification. Joint, simple, complex, combined, all joints, general characteristic features of the joint. 5 general characteristic features which you must find in each kind of the joint. First is articular surfaces. Articular surfaces minimum 2, maybe more. Then these 2 surface units together in the outer side by the articular capsule, capsule articularis. Articular surface in Latin, fascias articularis, articular capsule, capsule articularis. Between 2 surfaces or more, the surface of the joint must situate articular cavity, cavitas articularis. This space which separates 2 articular surfaces present by all the lengths of the articular surfaces. And the capsule of the joint, we can separate one part of the joint from another. Also, in articular surfaces must covers by the articular intra-articular cartilage. Intra-articular cartilage. And also in the articular cavity, covered by the intra-articular cartilages, must situate inter-articular fluid. Inter-articular fluid. Okay, and now we'll speak about non-obligatory elements. What does it mean, non-obligatory elements? They may be present or may be not. In some joints, you may find some non-obligatory elements. In other, you may find another. First of all, the ligaments. Ligaments of the joint. There are 3 kinds of ligaments of the joint. First is intra-articular ligaments. These ligaments inside the cavity of the joint. They may be present or maybe not, as I said. Then, intracapsular ligament. This ligament situates inside the capsule of the joint. And the third kind, extracapsular ligament. They situate close to the capsule but fused with the capsule of the joint. Then, tendons. Then, bursa. Bursa, it's projections of the capsule of the joint in which collects the intraarticular fluid. Also, this bursa, in Latin bursa, in English bag, these bags or these bursas situates close to the extra articular ligaments and tendons of the closed, and the bursas prevents the friction of the tendons and the rupture of them. Discs and meniscus. Discs and meniscus is the intra-articular component which bound by the cartilage. They may be present, maybe not. Labra and plica synovialis, the synovial folds. The synovial fold situates in the intra-articular capsule or articular capsule in inner layer of it. Maybe also present or not. And now we'll speak about one by one components, and I explain you for what they need. First, the cartilages. The cartilage. The articular surface of the bones covers The cartilages helps to reduce the friction of the bones when they move one to another, to reduce the friction of the articulation surfaces. The cartilages, articular cartilages, haven't any pain receptors and the blood vessels, and have very low coefficient of the friction. This is the cartilage. This is the cartilages, intra-articular cartilages. Then, synovial membrane. Synovial membrane situates in the synovial, in articular capsule. Synovial membrane is inner layer of the articular capsule. Synovial membrane will be useful for producing of the intra-articular synovial fluid or synovial fluid. And this synovial fluid, which produced by synovial membrane, take part in two very important processes. First, it prevents the friction between two articulation surfaces, which covers by the intra-articular cartilages. It prevents the friction from one surface to, and also the synovial fluid will be useful for nutrification of the intra-articular cartilages, because as I said that these cartilages haven't any blood vessels. That's why the nutrification of the goes by the simply diffusion of the nutrition facts which present inside the synovial or the intra-articular fluid. Okay. And articular capsule. Articular capsule covers the articular out. It's like an outer layer which unites two articular surface and lateral side without the covering of them, because they covers by the cartilage. This is articular capsule. It consists of the collagen fibers. This is articular capsule. And also, as it may have ligaments. The ligaments.
Sorry, I have a question.
Yes.
These names are Latin or English? These names in PowerPoint.
You must use English or Latin names, but I use both. Latin, I think Latin and English names of the structures is rather same. Yes, but you must use, as you see, I use both Latin and English. Yes.
For example, ligament is English, yes?
Ligament, the same names in the Latin and in English. For example, ligamentum femoris, the ligament of the head of the femur, ligamentum capitis femoris. But in your manuals, which present in our website and in your tests and your in-class work, you must use. Okay.
Excuse me, Professor,
Okay.
what about exams? Should we use English names or Latin names?
Latin, an exam Latin, only Latin.
Thank you.
Okay, let's continue. Now we'll speak about ligaments. Ligaments, for what they need and where they situate. It's built by the connective tissue, which surrounds the joint and gives support and limits the movements in the joints. they look like special stops which prevent damaging of the system which named the joint. Ligament tendons. Tendons are usually the tendons passes through the joint upper than it, or may situate inside the capsule of the joint, and the tendons is the ends of the muscles. For example, if you look quadratus femoris muscle, the tendon of the quadratus femoris muscle passes through the knee joint and inserts in the tibial tuberosity. And when it passes through the capsule of the knee joint on the anterior surface, it's have the bursa. The bursa is the projection of the capsule of the joint is like present here, which full of synovial fluid, and the bursa friction between the tendon of the joint and the capsule, tendon of the muscle, sorry, and the capsule of the joint, as is present here. Bursa, fluid-filled sacs between bones, ligaments, or other adjacent structures help fusion of the friction in the joint. Yes. And look here, tendons and ligaments passing through the. What the question?
Would you show bursa?
Bursa. Okay, yes. Look, this picture here you can see the name bone. Yes. After that, yes. It situates the cavity. This between the tendon and muscle, which names bursa. This is synovial bursas, which covers by the synovial membrane and produces synovial fluid. This is bursas.
Yes, okay.
And look here. Also, if we speak about the tendons and ligaments, as I said, the ligaments may be intra-articular ligaments, which situate inside the cavity of the joint, for example, as you see here in the hip joint, between the head bone, which present here, head of femoral, and acetabulum, situates ligament. This ligament names ligamentum capitis femoris, which connects the fovea capitis femoris in the head of the femoral bone with acetabular fossa of the acetabulum, which situates in the hip bone. Inside this ligament passes nerves and vessels, which gives blood and nerves supply to the head and the neck of the femoral bone, caput femoris, column femoris. And also you can see the structures which names labra or lip in Latin, labium glenoidale, in English, lip. This lip is, or labrum glenoidale, is the cartilage which situates around the edges of the articular margins, which increase the capacity, volume of the surface of the articulation, one of the articulation surfaces, and it gives stability to the joint. For example, here you can see the shoulder joint. The shoulder joint situates or bound by the articulation surfaces. From one side is carpet of the humerus bone and its articulation surface, and from the scapula is cavitas glenoidalis, glenoid cavity on the borders of it. You can see the projection of the cartilaginous tissue, which names labrum glenoidale. This is labrum glenoidale. It's increased this the square of the articulation surface of the scapula and of part in the stability in the shoulder joint. Then the fat pads. The fat pads situates inside the joint, the capsule of the joint, close to the articulation surfaces, and they work like for the amortization in movements of the in the joint, between amortization of the movements between the articulation surfaces, like anti-shock structures, prevent the shocking powers in the joint. They prevent the damaging of the joints. Discs and meniscs. Here, intra-articular discs and meniscs. First, the disc. Here at the right side on your screen, you can see the disc. Articular disc or the intra-articular disc. Discus articularis. Articular disc separates two articulation surfaces, one from another, but don't fuse or attach with them. Between the disc and one articulation surface, you can see the fully spaced, and between the disc and other articulation surface, you can see also the fully spaced is the disc. The meniscus. Let's look to the left side, to the left picture. What you can see, this is meniscus. Meniscus is look like a falx or demi-moon structures, and meniscus, for example, you may find in the knee joint. The meniscus bound intra-articular cartilages and situates in one of the articulation surfaces. They will be useful for the changing of the axis of the movement and for the guidance of the movements in the correct direction. It will be the discs and meniscus articulation cavity for two spaces or for two chambers. For example, here in the meniscus, you can see temporomandibular joint, and you can see two stages or two floors or two chambers, upper chamber and lower chamber of this joint. Okay, let's continue. Now,
Excuse me.
what?
The last picture, please.
Last picture, okay. This one.
Menisc. Yes, is it menisc float in the articular disc?
Please repeat the question once again. I don't catch the problems with the sound.
Is the menisc float in the joint in the articular space?
Look, if we speak about the meniscus is the projections of the one of the articulation surfaces. Here you can see the meniscus in the knee joint. In the knee joint, you can see the meniscus. Here it is, and here they are like a projection of the two articulation surfaces of the T, and they don't separate the intra articular, the space between articular surfaces fully. Partly, yes, but not fully. This is the differences between the discs and meniscus. And discs and meniscus may be present or may be absent in some joints. For example, disc present in, here is the disc in the temporomandibular joint, and meniscus are present in the knee joint. I answer for your question? Yes or no?
Yes, yes. Okay, thanks.
Let's continue. Now we speak about the classification of the joints. Classification of the diarthrosis. First, bone, articular cartilage, intra-articular fluid, articular cartilage, and bone. It's the small reminder for you about the part which we discussed about obligatory and non-obligatory components of the joint. Yes, all joints have minimally two bones which bound articulation surfaces. These two surfaces covered by the intra-articular cartilage, and between these surfaces, bony surface which covers by the intra-articular cartilage, situates space, and all this covers externally by the articular capsule, and between two articulation surfaces which covers by the articular cartilage, in this space you found intra-articular fluid. Now we speak about classification of the joints. We can classify the joints by different aspects. First, by the amount of articulation surfaces. If the joint bound by two articulation surfaces, this joint is simple joint. For example, hip joint bound by the head of the femoral capitis femoris and acetabulum. Only two articulation surfaces, as the same as you see here in this picture. In this picture shown the shoulder joint. Also,
Excuse me. We can't hear you.
once again, I don't know why you switch off. Who is switching of my microphone? I don't know. Okay, once again, if we speak about classification of the joint may be by the amount of the articulation surfaces. It may be simple or non-simple. The simple joint have two articulation surfaces. For example, the shoulder joint or the hip joint. If there are three or more articulation surfaces, for example, as in knee joint or in the ankle joint, it's non-simple. Compound. It's named compound articulation joint, compound joint. Non-simple or compound. For example, here is present ankle joint. Oh, no. It's now ankle is elbow, sorry. Elbow joint. Here you can see the bone which names humerus, here, sorry, here you can see the articulation surface head of the radius, articular circumference, and trochlear notch of the ulna. More than 2. It's compound. If 2 is simple, 2 is compound. Other characteristic. If inside the joints non-obligatory components, discs, meniscs, intra-articular ligaments, its names complex or complicated joint. Complex joint. When you can some intra-articular components. And joint may be also combined. If 2 anatomically isolated joints cannot work one without another, it's named combined joint. If they can do it, it will be non-combined joint. And if you look here, if we speak about combination of the joint may be only simple or compound. This or that, simple or compound. But, for example, simple joint may be complicated and combinated or non-combinated. For example, the classic example, temporomandibular joint, bound by the surface of the 2 bones, temporal bone and the head of the mandible. That's why this joint will be simple. This joint have intracapsular components, which names discus interarticularis, intraarticular disc. That's why it's the complicated joint or complex joint. And one temporomandibular joint cannot work without the working of another. You open or close your mouth, both temporomandibular joint works together. That's why this joint is combined also. If we speak about description of the temporomandibular joint, this joint is the simple, complex combined or complicated combined joint. Complex and complicated is the same. Now we'll speak about degrees of the freedom of the joint. If in joint you can see the movement only in one plane, for example, in elbow, it will be uniaxial joint, one axis of the movement. Moves in 2 planes, it's be biaxial. In 3 and more planes, it's named triaxial, or better names multi-axial joint. By the degrees of freedom in 1 plane, uniaxial, in 2 planes, biaxial, in 3 and more planes, multi-axial joint. And also made the classification by the shape of the articulation surfaces. First, hinge joint, then pivot joint, then plane joint, then bicondylar joint, saddle joint, ball and socket joint, and ellipsoid joint. And if we fuse together these 2 classifications by the shape of the articulation and by the axis of the movement, you may find the such examples. Uniaxial joint. If you speak about the uniaxial joint, by the shape of the articulation surface, they will be the pivot and the hinge joint. Biaxial joint. Biaxial joint, by the shape of the surface, will be the bicondylar, saddle, and ellipsoid joint. And multi-axial joint, plane, spheroid, and catilica joints. But plane and catilica is the general cases of the spheroidal joint. Once again, the classification by the shape of the articulation surfaces and the axis of the movements. Uniaxial joints will be the pivot joint and the hinge. Biaxial joints will be condylar, saddle, and ellipsoid. Multi-axial joints will be spheroid joint, plane joint, and catilical joint. Here you can see the examples. Ball and socket joint. For example, the ball and socket joint will be the joint between glenoid cavity of the scapula and the head of the humerus. Shoulder joint. Pivot joint. The pivot joint is the joint between the articulation surface of the radius, which names articular circumference, and radial notch of the ulna. Its names radio-ulnar joint. They may be two, proximal and the distal. Also, you can see the saddle joint here in the bones of the hand. Then, hinge joint. The hinge joint, the classical hinge joint will be the knee joint. Ellipsoid joint. Ellipsoid joint in the bones of the forearm and the bones of the first row of the carpal. It's next the wrist joint. And the plane joint you may find, for example, in the between the articulation facets of the articulation processes of the vertebrae. Intravertebral joints or zygapophyseal joints. Articulatio zygapophysealis or articulatio intervertebralis. They are, by the shape of the articulation surfaces, they are plane joint. Okay, students. This is all what I want to explain you in this lecture. Have you any questions about this lecture material?
Excuse me, Professor. I have some questions about spine. May I ask you?
About what?
Spine.
Uh-huh.
What is costal process in lumbar vertebra?
Costal process in lumbar vertebrae. Okay, students, if you look to the lumbar vertebrae, the transverse process is named because they bound by the fusion of the lumbar ribs and transverse process of the lumbar vertebrae. That's why, but better to name them processes of the lumbar vertebrae. Process transversi vertebra lumbalis. Okay?
Yes, you mean because of the transverse process is homolog with ribs, yes? We call them costal.
Yes, the root as the same as in the neck region. I think you remember if you look to the vertebrae of the cervical region of the neck. Yes, the seven. Each of them have the transverse process with foramens. Foramina process transversi. Yes? Yes.
Yes.
These foramens bound by the fusion of the transverse process of the cervical vertebrae, which lies posteriorly, with the rudimental cervical ribs, which lies anteriorly. When these two structures, rudimental cervical ribs and the process of the cervical vertebrae, fuse together, they bound foramen between them, which names foramina process transverse. But in the lumbar region, the rudimental lumbar ribs and transverse processes of the lumbar vertebrae fused together without any foramens, but they names processus transversus of the lumbar vertebra. Processus vertebra lumbaris. Okay?
Yes, thanks. And what does mass in atlas vertebra made by?
Once again, what is?
What does mass in atlas vertebra made by?
Massa lateralis?
Mass of the atlas vertebra. In the standard anatomy site, it wrote it's
If
made
you
by superior and inferior articular.
Okay, if we speak about first cervical vertebra, about the atlas, it's have the lateral masses.
Yes,
But I think you must ask this question not for me, but for your teacher in your anatomy classes. But if you ask it for me next time, students, if you have some questions about material of the your, please ask it for your teachers. But for me, it's not so hard to explain for you. The lateral masses is the huge masses of the bony tissue which connects two arcs, arcus anterior and arcus posterior atlantis. And muscle on the lateral masses, you can see two articulation surfaces. Superiorly lies superior articulation surface which take part in the atlanta accipital and connects with the via the capsule with occipital condyles, condylus occipitalis of the occipital bone. Inferior surface connects with the articular surface of the lateral mass with superior articular surface of the second cervical vertebra, which names axial vertebra. Only for this we need lateral masses, and the lateral mass connects anterior and posterior arc of the atlas, anterior and posterior atlantis.
Thank you, Professor. I have one more little question. Do you have pedicles in axis vertebra? Pedicles. Because I can't see the picture.
In which vertebrae?
Axis.
Axis.
Yes.
As pedicles, they don't mark. At level of the pedicles, you can see lateral masses, massa lateralis. It looks like a pedicles. Yes. But if you look to any pictures of the or any pictures of to the atlas, you never found any pedicles.
Thank you. And you say, yes, we clearly not have pedicles. Yes.
What? I don't hear you. What? Who have pedicles?
Axis vertebra.
Yes, it's have pedicles. Yes.
Pedicles. Thank you. Professor, I have a necessary work to you. Could you please answer your phone after the class?
For anatomy class, who's your teacher in anatomy class?
Mr. Limas.
Who?
Mr. Limas. He is our anatomy teacher.
Maybe you ask the questions about the vertebrae and their how they look like to him or to her, because topic of our lectures. That's why please ask these questions about the bones, which you have difficulties in bones.